Hi all, welcome to OET Speaking. Today we can discuss an OET role play. Here this setting is a cardiac unit. Your patient is an 80-year-old who presented to ER last night with chest pain. An ECG and blood test showed evidence of myocardial infarction. The doctor recommended an angiogram for him, but the patient is really anxious. Your doctor has asked you to explain the procedure and associated risk. Task: ask about his concerns, explain about angiogram procedure, sedation, catheter usually placed in wrist or groin and guided into the heart, X-rays taken to see the heart vessels in detail, reassure and explain that complications are rare, reaction to die, stroke, cardiac arrest, death. Explain the importance of performing angiogram. Accept that the patient wants to seek another opinion before having the angiogram. Here, the setting is a cardiac unit and you have the details of the patient with you. So, you need to ask the name during our preparation time. Let's assume the name is Mr. John. So, you can start your conversation by saying, "Good morning, Mr. John. My name is Sarah. I'm your attending nurse today." Here, in the background information, it says that patient is really anxious. So, you can ask question like, "Mr. John, you look so worried. May I know the reason for that?" Or you can ask, "How are you feeling now?" Then probably the patient may tell his concerns. He might be telling like, "Sister, I'm really worried because my doctor asked me to do some procedure that is called angiogram and I'm really scared of this procedure and I don't think it's necessary." In that situation, we need to reassure the patient. So we can tell him like, "Mr. John, it's quite understandable to feel worried in this situation. Try not to worry, I am here to help you. The doctor told me to talk to you regarding the procedure. That's why I have come to visit you." Then again, patient may ask you like, "Sister, is this procedure necessary?" If the patient asks questions like this, at that time you can tell him like, "I understand from your case notes that you are admitted here because of chest pain. We just suspected that you are having a small heart attack. You know, Mr. John, based on your blood reports, we confirm the possibility of heart attack. Doctors suggested this procedure to see whether any obstruction or blockage inside your heart vessels. So it's really necessary to do this procedure. Is that clear?" Probably again the patient may ask you, "Why you want to do this procedure?" I'm very concerned about the procedure. I don't know about this procedure." At that time, as per our second task, we need to explain about what is angiogram and what is the procedure. At that situation, you can reply like, "Mr. John, I understand your perspective. I will tell you regarding the procedure which we are going to do. Shall I explain?" Then after getting permission from the patient, you can explain like, "Usually it's not a painful procedure. Before the procedure, we will sedate you so that you won't feel any pain during the procedure. Then the second thing is, we are going to insert a small tube that is through your wrist or through your groin with a small camera attached so that we can see your heart veins and arteries, that is a blood vessel surrounding your heart. You know, Mr. John, we are doing this procedure to find out whether there is any blockage in your heart vessels. Is that clear?" In this way, you can explain. You can say, "Believe me, Mr. John, it's not a painful procedure. Usually before the procedure, we will sedate you so that you won't feel any pain during the procedure. Then the second thing is, we are going to insert a small tube that is called catheter, which is inserted through your wrist or your groin with a small camera attached so that we can see your heart veins and arteries, that is the blood vessels surrounding your heart. Is that clear?" Again, you can tell him like, "You know, Mr. John, we are going to do this procedure to find out whether there is any blockage in your heart vessels. Is that clear? Or are you following me?" Sometimes patient may ask you questions about complications of this procedure. Or sometimes patient may ask you that, Doctor told that I might have something that is complicated. In that situation, we need to reassure the patient and explain that complications are very rare and possible complications we need to explain. So we can tell him like, Mr. John, whenever we are doing a procedure, usually we inform the possible complication along with its benefits. So the doctor has told you that there may be chances of some complications such as allergic reaction to the dye, that is the medicine using during the procedure. Don't worry about the allergic reaction because we will giving you a test dose. We will give you a test dose before giving the full dose. So usually it won't happen. Then there may be chance of getting sudden stroke, another episode of cardiac arrest or even death. Are you following me? I know you are really worried about the procedure. I would like to tell you that the complications are rare, and it's our hospital protocol that whenever we are doing a procedure, usually we inform the possible complications along with these benefits. That's why doctor has explained everything. At that time, probably the patient may tell you like, sister, then I don't want this procedure. Then we need to assure the patient. So you can say like, please be relaxed, Mr. John. I just listed all the complications. These all are very, very rare. People who are having more lethal conditions may get these all complications. But in your case, you are not having any lethal problems. So you will be much more better. Is that clear? So we can say like, these complications are very, very rare. People who are more into fatality or having more lethal condition may get these complications. In your case, you are not having any of those problems. So it would be better to do this procedure. Is that okay? Probably as per the interlocutor's card, he may tell you like, no sister, I think I should wait. I want to wait for some more time so that I can consult with some other doctor or my family doctor. In that situation, as per our last task, we need to agree with the patient. So you can say like, okay Mr. John, no problem. I do really understand your situation and I respect your decision. So we will definitely wait until you take a decision regarding the angiogram. Sometimes patient may ask you, sister, if I have any blockage, will I get any complication? Then you can reply like, Mr. John, to prevent you from another occurrence of this situation, we need to find out the percentage of the blockage. Then only I will be able to tell you more about it. If there is any blockage, we need to do a small surgery. Or you can say, if you do this angiogram procedure, then only we will find out the percentage of blockage so that we can prevent the occurrence of another life-threatening situation. As per the interlocutor's card, patient may not accept this procedure. So, we can tell him like, okay Mr. John, I certainly understand your wishes. You have the right to take the decision. I respect that. And we will wait for your decision. Thank you, Mr. John. Then you can ask, do you have any other concerns? Or is there anything else other than this? If there is no concerns, you can wind up by saying, thank you for listening to me. I hope I have cleared all your concerns. Thank you, Mr. John. Please take rest. I wish you a speedy recovery. In this way, you can wind up your conversation.